Hello everyone, welcome to today's video, and as usual I'm Holly Edwin, your daily health worker and founder Nandota Medical Foundation. In today's video we are discussing about the types of cerebral palsy. There are basically 5 major types of cerebral palsy, each which differs from the other in the way of presentation. The first one and the most commonest is called spastic cerebral palsy. And in this case, patients are always having increased muscle tone, characterized by stiffness and difficulty in initiating movements. The muscles tend to be thicker than normal and rigid, and hence initiating a movement either of both limbs or the lower limbs or the upper limbs is always hard due to the rigidity of the muscles, and hence this makes movement and coordination limited due to the stiffness of the muscles. 2. The second type of cerebral palsy is dyskinetic cerebral palsy, and this is the second most common type of cerebral palsy. It affects people of all ages, ranging from early childhood, and in this case the patient has involuntary movements of the body muscles, ranging from writhing, jerking, or sudden movements, and this may affect different parts of the body. For example, you may find when a child is yawning involuntarily without his control. You may find when the baby is trying to stretch the hand involuntarily without his or her own command. You may find when the whole body is jerking as if somebody is having an attack, and yet it's just involuntary movements of the muscles. So that's the second type of cerebral palsy. The third type of cerebral palsy is called ataxic cerebral palsy. This is always characterized by lack of balance or coordination of the muscles. In this case, the individual cannot stand because why? They are unable to control their fine motor skills. They are unable to control their movements. When they try to stand, they always fall off. Why they fall off? Because they cannot control their balance, and hence it's called ataxic cerebral palsy, due to affecting the posture and balance of the children. Number 4, it's called the hypertonic cerebral palsy. In this case, the children tend to have weaker muscles than normal, and hence their limbs or their bodies are always floppy. They are always weak. They cannot stand or they cannot support their bodies because their muscles are weak. It's literally, in simple terms, it's like the opposite of spastic cerebral palsy. In the spastic one, the muscles are thicker, are stronger and rigid, and in the hypertonic, the muscles are weaker, and hence the joints cannot coordinate with the weak muscles to support the individual who is standing. And in this case, we have a client known as Angel, whom we registered in an NGO, a young girl of 5 years. She has this type of cerebral palsy, and shall request you to watch our next videos for you to be able to identify that young girl, and we have a plan of coming out with social support and medical support to her. So we therefore request you support us when we are helping that individual who is suffering from cerebral palsy. And number 5, it is the mixed cerebral palsy. As the word is mixed cerebral palsy, it means the patient who is experiencing this type of cerebral palsy can experience spastic cerebral palsy, dyskinetic cerebral palsy, ataxic and hypertonic cerebral palsy at a go. Or you may find that patient has a mixture of either two types, for example, spastic cerebral palsy with dyskinetic cerebral palsy. Or he may have ataxic symptoms associated with dyskinetic symptoms, and also at times associated with hypertonic cerebral palsy symptoms. And hence, one individual will be having symptoms which are similar or which are in combination of the different forms of cerebral palsy. And hence, this calls for long-term therapy of these patients. They normally need physiotherapy, constant medical review, constant social needs, and family therapy. Just because it's a lifelong condition. So we, as the Long-Term Medical Foundation, our aim is making the world a better goal, a better place for everyone. So we are therefore looking forward to helping individuals and families who have children or people suffering with cerebral palsy. We therefore request you to subscribe to our channel and follow us for the next upcoming videos. Thank you, and see you in an upcoming video. Bye bye.